Welcome back to Sketches and Surgery. My name is Earl Stephenson Jr. I'm a board certified plastic surgeon here in Atlanta, Georgia, and today we're going to talk about genioplasty, specifically sliding genioplasty. You're asking yourself, well, what is that procedure? How does it pertain to me? How do I know if I have it? And what can be done about it? So let's dive in today about explanation of genioplasty, how it's performed, how does one diagnose it, and briefly touch on what to do about it. In subsequent videos, we'll talk about the specific procedures to treat specific issues. So if you like this type of content, please leave a comment below or hit the subscribe or like buttons no matter where you are. This will help me build my channel and help me present more information like this to you so that you can make the best decisions possible. And on that note, genioplasty is just a fancy word for remaking the chin. And what we do with that is we look at a patient's profile or client's profile and we determine if the chin is too strong or too weak. The fancy word or medical word for a chin that is too strong is called macrogenia, macro meaning large. The fancy word for a chin that's too weak or too small is called microgenia. And a lot of clients or patients come to me specifically because I have additional training not only in plastic surgery but oral and maxillofacial surgery, and they are concerned about their profile because on profile they do not have the chin or neck contour that they desire. So when I engage with them, we go through this process of explaining what I can do for them, and I obviously have to evaluate them. So how does one evaluate genioplasty? But before I get into that, let me talk to you about the causes of genioplasty, which in my mind are pretty simple. We look here. In my opinion, the main cause is genetic. Someone in your family had a recessive or weak chin, or jaw for that matter, or a very prominent jaw or chin. So that's typically where this problem lies and where it originates. Now, I'm sure there are some other instances where you can have overgrowth of the lower jaw, such as an acromegaly, but you have general overgrowth of every part of every bone in your body. So it's not likely to isolate toward the chin or to the chin. You certainly can have a weak chin produced by destructive diseases like rheumatoid arthritis, as we look at our lower jaw, that can destroy the jaw joint, which basically shortens the jaw joint and causes the chin to kind of rotate backwards. Obviously, that can be a cause as well, and that needs to be treated in addition to treating the jaw or facial discrepancy. But in general, most clients come in because they have a genetic component. So obviously when they come in, I actually take pictures, I sit down and talk with them, and I evaluate a couple of things on a profile view from a picture. Let's move over here and I'll scoot because I've got this little sweet desk that's a dry erase board. So what we have here is a schematic of a face. When I look at someone's face in real life, and I take pictures in this regard as well, I look at the thirds of the face. Are they balanced? It's the upper third from the hairline to just about the brow, 1/3 of the face. It's the brow to just below the nose, the second third of the face. And it's from the nose to the point of the chin, represent another third of the face. If any of these things are imbalanced, that leads me to investigating more as to why and what we can do about it. So when we focus on the lower third of the face, from the base of the nose to the point of the chin, and I'll zoom in here, you can see that third is broken up. 1/3 of that third should be base of the nose to the upper lip. The remaining 2/3 should be basically at the bottom of the upper lip all the way to the point of the chin. If someone has too much excess, meaning their face looks long, where this 2/3 is now representing more than 2/3, or the total lower facial height is increased. Now it's not 1/3, it's 2/3. Then we may have an abnormality in the development of the chin and jaw from a vertical direction. From a horizontal or side view or sagittal direction, what I do is I look at a point which is kind of the bony, kind of outside opening of the ear, and an imaginary line that goes straight across to the bony edge of the bottom of the eye socket, straight out into infinity, and then I drop a line from that touches the forehead, the nose, the base of the nose at the junction of the upper lip, and straight down. And with that, I can tell the position of the chin, just from an aesthetic standpoint. There are numbers that correlate to this of the distances, but at the end of the day, you need to appease the eye and not appease the numbers. So in this particular case, for this gentleman that I've sketched very quickly here, in my opinion, his chin is pretty far back for a gentleman. It would be nicer if his chin were closer to this line. In some regards, depending on his upper jaw and lower jaw relationship, right on the line. For a lady, it's okay for her chin to be back behind the line to a certain point, not to a point where it produces a chin that looks weak and produces poor neck contour. A chin that's farther back gives you a shorter looking neck. A chin that's too far forward does give you some stretched out appearance to the neck, but it still can have a poor anatomy. So this is what I look at from a side view, just looking at the client. Now let's back up. Let's move here. So if I'm inside the mouth, and I'll scoot over in my chair, I look at the relationship of the teeth, because that tells me not only what's happening with the chin, but it tells me what's happening with the jaw. So we'll zoom in and see if that works. If it doesn't, we'll zoom back out. And I'll move over, and I think that works pretty good. So, side view. If we were just looking at the bones, everything moved away, I would look at the relationship of the upper front tooth to the lower front tooth. And so, if that relationship is normal, you should have more of this type of configuration. If the jaw is too prominent and the chin, then this moves out, where this upper tooth is further forward than the lower this lower tooth is further forward than this upper tooth. So that means that chin has moved forward. It's just the opposite for a weaker chin. This is further back, and so this relationship is not normal, and the chin is further back. So that gives me a clue as to what's happening with the chin. And the lower jaw, which is very important. You need to figure out what's happening with the lower jaw as well. So if I really want to hone in, is this the chin or is this the lower jaw? Then I would look at the relationship of the first molar tooth. So let me write that down. First molar tooth. In a normal relationship, this is a class 1 relationship where the upper jaw and lower jaw are in perfect harmony. That means on the bottom, this bottom molar or first molar, the beginning tip sits in the center part of the first molar of the upper jaw. That is a normal relationship. Now, what if you have a jaw that's too far back and it's not the normal relationship, which is called a class 1 occlusion? What does that look like? So let me see if I can back this out, and then we'll do a little drawing. So we're going to change this to a class 2 occlusion, meaning it's going to be a weaker jaw. The jaw is going to be back, the chin is going to be back. So we're going to erase that. And then we're going to draw the molar tooth of the lower jaw. I think this one is bitten to dust, so let me pull out another marker. So we're going to move that lower tooth, and let me erase that to a position as such. So now, as we zoom in, you see that in a class 2 occlusion that this lower jaw is back. It's back, which makes the chin and jaw go back. That's a class 2 occlusion, and it's really a class 2 malocclusion, mal meaning bad and Latin meaning abnormal. So not only is the chin weak, but the jaw is weak. And once I finish the other illustration, I'll tell you what all that means in a nutshell. So we can have quite the opposite too. So let's back out yet again. Let's erase, and let's talk about a class 3 malocclusion, where we have, again, the first or the upper molar in the normal position, but now we've got the lower molar, lower first molar, in a more forward position. So now, if I zoom in, this is now class 3, and oops, this particular situation, now the lower jaw is further forward as well as the chin, and it gives you more prominence to your chin, so you have a stronger chin or macrogenia. So that's how I can tell whether this is a jaw or chin issue. If the molars present in an abnormal fashion, then it is more of a jaw problem, meaning that the best solution for this would be a lower jaw and sometimes even an upper jaw surgery. If the molar relationship is a class 1, which is a normal molar relationship, then it's not an issue in and of itself of the jaws. It's purely an issue of the chin. And so I would, in that scenario, look to isolate and treat the chin. So how do we briefly treat the chin? As I wrap up this first episode, we basically perform a surgery under general anesthetic that is an outpatient surgery. And during that surgery, I access the chin bone itself through the lower lip on the inside, and I basically make a cut in the chin. And let me draw that here. So I'm going to draw that with a dotted line. A cut in the chin, like so. With that cut, I can separate the chin and I can move it anywhere I want to. And let's do this on this illustration here so you can kind of get 2 dimensions of it. So let's do this. So we're going to do this. So I would cut the chin in those dimensions, and so that we can move it forward, we can move it backwards, we can move it down, we can move it sideways. So it really gives us a lot of latitude to really treat any abnormality or facial imbalance that involves the lower chin. So this is what a genioplasty is. Here's how we can really tell what the nature of the problem will be. Is it too far forward? Is it too far backwards? Is it too small in a vertical dimension or short, or is it too long? Or we can look at our molars or inside the mouth and tell us if the molar relationship is normal or not normal, leading to If it's abnormal, then it may be a lower jaw issue in which you need lower jaw surgery, and that would be the best answer. In subsequent videos, we'll talk about more about the surgical procedure itself, how to treat various chin issues to full, in the sense of being too far forward, too weak, too short, too long, asymmetric. So we will talk about that in various videos and go through any issues of those types of treatments. So I like to thank you for spending some time with me on this first episode of Sliding Genioplasty from Sketches and Surgery. This is Earl Stephenson Jr., your Atlanta board plastic surgeon. See you soon.